we're ambitiously looking at extending this across all of our services. We're going to start with the high-level, high-volume challenge specialties, such as trauma and orthopaedics, paediatrics, plastic surgery, dermatology, gynecology, the usual suspects. But obviously, it's a challenge, so we will start small and we'll do it in bite-sized pieces, really. But we need to get every patient that comes through the wall free on an 18-week compliant pathway. So one way to start that is to look at the map of medicine and look at what we've got now and change that.
How valuable a tool is it proving to be in your region?
I think it's invaluable with regards to service improvement. As I said, it's a real good starting tool. We can see we've got some sort of drafts of where we are now and where we need to be. So I find it a very useful tool. It's also a really good visual tool, and it gets clinicians involved in the process.
It's almost going through that process that is part of the value, isn't it?
Absolutely, yeah. We find out where all the bottlenecks and the problems are as we go through the process. And we're redesigning as we go along. So it's almost becoming sort of business as usual, and it's putting service improvement, embedding that within our ethos really across the trust.
As a Commissioner of Care, what are the main benefits for you of having the map localised in your area?
Well, I think from a commissioning perspective, the useful part of it is we can look at what can we deliver in primary care, what should be coming into secondary care, and we can actually change around the way we deliver our services. And also adding the timelines to the map. That gives us great incentives to move things into different areas and to look at, good example with the carpal tunnel pathway, we've moved nerve conduction into primary care. So although we actually deliver the service in the hospital, they don't come and see the consultant until all the workup's been complete. So using the map of medicine just highlights what needs to be done and how can we deliver it differently.
So it's almost helping that move towards integration of the two levels.
Absolutely. And also for dissemination as well. Once the GPs are actually up and running with the map of medicine, which we hope will be quite soon, we can then say this is the royal-free best practice pathway. And we can disseminate that much easier if they've got access to it in their surgery rather than us sending out paper copies of maps.
Are you finding that it's creating a common language between clinicians and managers?
I think it will. I don't think we're quite there yet, but I'm hoping that that will be one of the big benefits of the map. Certainly it sort of starts talking and it gets people to communicate better.
What will be the benefit for the patients?
Just delivering better services, more efficient, streamlined, cost effective, in some cases closer to home. All the benefits of providing a better lean service.
Do you think that it makes what is delivered for them and the conversations that they are having with the health professionals clearer because the map's there? Not all health professionals are good communicators, are they?
I see. I think that benefit would probably be seen more in the primary care setting rather than the secondary care, but certainly yes, there is that element, and it's an educational tool as well, so it does provide the communication and the education. It
can take a lot of effort, can't it? Why is it a worthwhile effort?
I think it's twofold really. Firstly, we can look at the timelines on the path. So from a personal perspective, that helps us meet 18 weeks, and that's a tick in that box. But mainly, for me, it's about evidence and providing good practice. So we've got the library staff involved, and we can use the national service frameworks, any good practice guides or evidence and research that's out there at the moment, and make sure we bring that into the pathway, and make sure that what we're changing, we can't just change pathways willy-nilly, we need to make sure that they're following good practice. And the map of medicine just gives you the structure to do that, and we need to sign things off, so we're following good governance practice.